Hello and welcome to How to Survive Healthcare. I am Kayla Thompson-Riviere. I have over a decade of experience as an RN in the ER and ICU. Now I'm helping people as a dedicated advocate.
And I'm Nicole Broadhurst, a healthcare billing specialist and financial advocate, here to make sure you're not paying more than you owe.
We're here to share the insider tips and tricks you need to navigate the healthcare system, avoid common pitfalls, and get the care you deserve.
Because no one should feel lost or overwhelmed when it comes to their health.
Now, it is important to note that the information we share on this podcast is based on our experience and research, but it's not intended to replace professional medical advice. But whether you're a patient or a caregiver, you're in the right place. Welcome back, everyone, to the podcast. It is almost Christmas, so if you celebrate, Merry Christmas. If you don't, well, hopefully you at least enjoy the air that is around right now. Clearly, we celebrate Christmas. Nicole's got her tree. I went to the Dollar Tree and found these fake glasses and pulled this off and actually hot glued it onto my real glasses. So committed to the look here.
I love it.
Yes. Now, I know a lot of us are traveling and seeing our loved ones, and it's such a wonderful time. However, when you are traveling around, particularly if you do have ongoing medical issues, we really want to make sure that we're keeping ourselves safe and not opening ourselves up to any issues, emergencies, or things that could be avoided this holiday season. The holiday season can be a tricky time to engage with the healthcare system. Well, when isn't it a tricky time? That's why we're here. But even more so, just like every other industry, there's people taking time off. There's often not as many staff members. Doctors have tendency to, take vacation, go see their family as well. It can be harder to get appointments. So as much as we can, I'd actually encourage to try to stay away from the healthcare system during this time. Obviously, emergencies happen, and that's really part of what we're going to cover here today. So I've got some strategies for managing yourself and your family while you are traveling. So really 3 tips for our chronic conditions while traveling. Number 1, make sure you refill your prescriptions way ahead of time before you travel. If you're if you're leaving on Tuesday, don't be trying to pick up your medication from the pharmacy on Monday. Okay, you want to plan for probably the Wednesday or Thursday before, if you can. If you're not quite in your prescription window, or your prescription is going to run out while you're away, but it's too soon to fill it, you do have a couple of options. Number 1, go talk to your pharmacy. Sometimes, depending on the medication and the insurance, there can be some wiggle room around when you can get that filled. Number 2, if that's not an option, let's say, for instance, it's something that is a controlled substance and they, specifically count it. Sometimes you can get the prescription transferred to another pharmacy. So if you're going out of state to visit a relative, but you normally fill at CVS, well, maybe when it's time to get that prescription filled, they can actually send it to the CVS that's near where you're going to be. If that's not an option, call your doctor who writes that prescription. Sometimes they can give you a one-time paper prescription so that you can take it with you to where you're going to go. There may also be some other options, but the point being, get your prescriptions filled ahead of time from when you need them, and then start a conversation with the people who manage those prescriptions so that you can make sure. You never want to be running out of a necessary medication while you are traveling. It makes it even harder to get it filled than when you're at home, which we all know can be a huge pain. Number 2, Nicole,
Kayla,
yes.
before you go on, I want to jump in here. I'm sorry, but I want to jump in here because there's a couple of things that I thought of in regards to this particular tip that I want to add and make sure folks are aware of. There are a lot of insurance carriers will honor a travel exception to fill your prescription for more than 90 days. So if you have an extended trip that you need more than 90 days, even, just know that that's an option as well, that you can call your insurance company, let them know that you're traveling, and that there's a process to request a travel exception so that you can get more meds than normal. The other thing that I wanted to share is, I travel extensively, is that you might also want to look at, if you travel, if it's coming up, again, this isn't something you can wait until the last minute, right? But I specifically use Amazon Pharmacy because they can ship anywhere. So no matter where I am, when I need my meds refilled, they can ship it to, for example, if I'm at my sister-in-law's in Arizona, they can ship them there. They can ship them anywhere. So once they have the prescription, that's an option as well. So just a couple things I wanted to add. Sorry.
Yeah, I love that. I didn't realize that about the if more than 90 days thing. I've never traveled anywhere for more than 90 days. So it just didn't occur to me. If you're listening and you're going somewhere for more than 90 days, I want to know where you're going. Let me know. I want to live a little vicariously there.
I love it.
But on the topic of medications and traveling, not only do you want to make sure you have enough medication with you and enough for longer than your trip, by the way, because you never know when a flight is going to get canceled or a flat tire. I usually pack plan for like a 20% extra is kind of my rough guideline. So, if you're going to be gone for 6 days, plan for at least 8 days, maybe 9 on that tight time frame, something like that. Just give yourself a little buffer room. Or God forbid, if you drop a pill or something, you don't want that to be the one that you needed.
Right?
But number 2, you also want to make sure you're carrying a summary of your medications and other health conditions with you. This is always important. I know that I've spoken before ad nauseum, not to just trust and say, oh, it's in my chart. Yes, a lot of information is in your chart. Way too much information is in your chart, that it can be actually difficult for your healthcare providers to filter through it all. But when you're traveling, particularly if you are out of state, it don't matter what's in your chart, because if you've got to go to an urgent care or something, they're going to have no idea. So now more than ever, if you haven't yet downloaded my Health Hub, this is a great time. That is my one sheet fillable PDF that I made totally free, herdforlife.com/health hub. But it lists your medications, your doctors, your conditions, and actually quite a few other important details, all on one page for you. That way you can update it, keep it on your phone, print it out, however it works for you, but it keeps it all at your fingertips. So have some way to have all your health information organized. Also, we've kind of touched on this a little bit, but my third hot tip for traveling is research your nearby facilities before you go. So we mentioned pharmacies, just in case, God forbid, the dog knocks over the pills into the toilet. I don't know. But you need to know where you can get things if you need to. But then also, wherever you're going to be staying, you want to know your urgent care options. And if need be, your ER options. How far is the closest hospital? If you're traveling with somebody who maybe isn't in the best health conditions, it may be wise to keep that in mind when you're making your booking arrangements, if possible. I don't know about you. I like to stay in Airbnbs, and sometimes that is a little bit of a radius from the place of where I'm going. For instance, I went to go visit my grandmother last year, and she lives in the middle of nowhere. And frankly, I couldn't find any place to stay real close to where she lives anyhow, but it worked out nicely because I was pregnant during our travels. And, they say, I live by the philosophy that I call myself, I'm not superstitious, but I am a little stitious. So I feel like if you plan for something, then it won't happen. Like, it helps to ward away the evil spirits. And we were lucky enough to find a place that it was like 20 minutes from my grandmother, but it was also 10 minutes away from the closest hospital, which
Nice.
it was right in between the two. So my grandmother was actually like 30 minutes from the hospital. So all that to say, not that I was planning to need a hospital, and I certainly didn't, probably because I planned for it.
Right?
But particularly if you've got that family member who, maybe they have been having a lot of trips to the urgent care or the ER, perhaps keep that in mind when you're making your booking, and stay at a location that it maybe is a little bit more accessible to those places than some of the alternative locations.
Oh, I love this. I love this. And this is after my true heart. I'm stationed in a sticks and bricks right now, but I'm a nomad at heart, and I will be traveling on the road again soon. And I can't tell you how important this stuff is, not just during the holidays, but anytime you're traveling.
Yeah.
Specifically, making sure that you're aware of what options you have available to you, regardless of where you're located. I know a full-time RVer who stepped off, anyway, had an accident and like shattered her ankle.
Oh
They
my
were on
gosh.
BLM land, way out in the middle of nowhere. I don't want to wait until something like that happens to figure out where the local hospital is, right? Like,
Right.
that's not so. I love what you're talking about in regards to making sure we know where these places are, and what do we do specifically during the holidays when we know that a lot of our physicians and the offices are closed for the holidays. Like, what are our options during when there's limited access to healthcare options, right? So some of the things that I want to make sure everybody knows about are: one, your insurance carrier, check your policy, because since the pandemic, a lot of insurance carriers are waiving telehealth from any cost sharing responsibilities. What does that mean, Nicole? That means that there isn't, like, a lot of them do 100% coverage. There's no copay, there's no co-insurance, you don't have to meet your deductible. My plan is that way. So anything that I can do through telehealth, and I think, Kayla, you talked about this before on a
I
different
have,
podcast,
yeah.
like how to know when. So I'm not encouraging you to do telehealth if it's not appropriate. But if it is appropriate, right, then look into that option. It will save you money, time, and it's convenient to do that, right? Because it's not location dependent. So, for example,
Right.
when my husband and I travel, we're able to call in to, I think our insurance uses Teledoc, and we can use Teledoc, and there's no out of pocket expense, and we can do it right from our trailer in the middle
Yeah.
of the desert,
You don't
right?
even have
So
to leave the Christmas party.
that's right. That's exactly right. So make sure that you're leveraging that if that's appropriate and it's available to you. Like I said, most insurance companies are doing that. Also, make sure that you're planning ahead, like Kayla said, like, where are the urgent care centers, right? And how far are they away? And a lot of times I've noticed, Kayla, in Airbnbs, the hosts, when they prepare their book, sometimes they include this information in their
Yeah,
guest book.
sometimes they do, which is really nice.
Yeah, don't count on that.
Yeah.
However, sometimes they do, right? But do your own due diligence to know. And the other piece of that is to understand urgent care is not an emergency. Okay. And so it does require out of network benefits. So if you have, check around, look for the local urgent cares wherever you're going to be, and then check their network status with your insurance company. All right. Two-step process. Make sure you know where it is. And then before you need them, check their network status.
Yeah.
Okay. So that's that. And then make sure, obviously, if you need to go to the emergency room, make sure that you know where it's at. Because
And
when
guys, I
you
just
need
want
it,
to let you know I have done a whole episode on kind of knowing where, what kind of bracket do you fall in? Is this a teledoc, urgent care, emergency? And I also have a downloadable one sheet printable how to, know where to go handout. So that's always helpful to have on hand. I didn't mean to cut you off. Okay, I'm going to cut this piece
You're
out.
okay.
That was dead air. Shoo. All right. So like I said, you can find that in the captions, but if you're just listening, it's herdforlife.com/know KNOW for that sheet of where to go for different types of things, when telehealth is appropriate and when the ER is your best choice. So really our key takeaways is, like most things medically related, prepare. You want to have a plan. Make sure you've got all of your medications and things that you need. You've got where your locations are for where you're going to be should the need arise to seek some urgent attention, or perhaps what benefits you have available to you if it can be handled by telehealth. So I hope this was helpful for you. Please put a plan in place, because remember, if you would rather have and not need than need and not have. And that cannot be more true for a plan for medical emergencies. So take that, make some plans before you travel, and may you have a most wonderful, happy, healthy holiday travel. Thanks, guys. See you next week. Bye-bye. Thanks for joining us here on How to Survive Healthcare. We hope you found this episode helpful and empowering.
If you're looking for even more resources and personalized support, head over to how2sh.com. That's how2sh.com. There you'll find tools, tips, and ways to connect with us directly.
Whether you need help organizing your medical information, understanding a bill, or navigating a tough healthcare decision, we're here to help.
And don't forget to subscribe to the podcast. Share it with someone who might need it, and leave us a review. It helps us reach more people just like you.
Thank you for listening, and we'll see you next time. Bye-bye.